Dr. Kremer here, Sandy. We're going to talk about medicine today, and specifically the gastrointestinal tract, which is a big part of functional medicine. I, of course, am a physician practitioner as well as a nutritionist, and we've been working together for a while now, and just trying to help as many people as we can.
Absolutely. So I'm going to go ahead and share the screen, and we are going to roll. So let me see here. Let me do. Okay, we're ready. I think. There we go. Okay, we're addressing GI wellness, so we want to look at the positive, and right there's us still. So our functional medicine, honestly, bottom line is getting to the root cause. Chronic conditions using comprehensive labs, lifestyle management, stress management, balance, right? Mindset, exercise, all of that fits in to our programs and to functional medicine by getting down to the root cause.
Yeah, and so the key is the balance. And,
Yeah.
And we have to find out where the imbalance is.
Yeah.
Get it in, and then put it into a lifestyle change.
Absolutely, that's doable. Right?
Absolutely,
that's doable. Even like these, crazy diets or short-term things as a lifestyle. It's making good decisions each day towards a goal of optimal health. So we have over 5 most. I always bring this up because GI ties in. Found GI. I say GI or gut. We're going to talk about leaky gut. That's a buzzword most people know about, but you might not, and you will by the time we get done. And then one of the labs we use in our program, we use 3 total. This is going to be 1 we'll go over today, and then diet and lifestyle tips. So 5 most common complaints, right?
So this is when we interview people, we find out what are they complaining about. Always fits into these 5 categories. I'm too heavy. I'm always tired. I have brain fog, anxiety. I'm anxious. I'm depressed. I have hormone imbalances and have bloating and gas.
Yeah, or tired, fatigue, can't sleep.
So it's hard. And the interesting thing also is that some people. We find out we'll do an analysis on their GI system, and they didn't even have any GI symptoms. Maybe they didn't have any bloating or anything. But meanwhile, they had total imbalance, which we call dysbiosis. So
yes, I just had a patient wanted to do a food panel. A lot of stuff came up. I said, okay, we really need to do the GI panel, because what we found was leaky gut, inflammation, all these markers, and she didn't really have the symptoms that most people will have because she's a little on the younger side, right? So eventually it catches up to you, and those symptoms get pretty bad later, so if not up front. So lifestyle and food choices, again, these are just underlying causes that cause the body to go off balance, bring in infections, for example, because you're not eating a good diet, and so your microbiome is off because the bacteria is not the good guys, it's mostly the bad guys, and so it plays havoc in your system, and it causes degeneration and all kinds of stuff that happen. We'll talk about this. Medication can definitely cause GI symptoms. People will take proton inhibitors, GERD, and what that does, it decreases the you actually need to break down the foods, and so then you become more alkaline, which is supposed to be a very acidic environment, and so that affects the small intestine and then the colon and all the digestion, because that one area is thrown off. So things like that.
And antibiotics.
Oh yeah.
Of antibiotics can mess up your gastrointestinal tract for 6 months or more.
Oh yeah, it can be a couple of years. It actually changes it forever to a happy balance again, because it literally will change the entire. Think of a soil. Think of a garden. right? If that soil's not good, then you goes and the nutrients coming in them. So, yep. So basically, foundation, 3/4 of our immune system is in our gut, which is why we go to that. Really work on gut health, make sure there's nothing going on there that's causing the immune system to go down. Very important. I will say sugar can decrease the immune system by, I want to say it's like, there's a huge percentage on that. I can't remember the number, but it's high. It's like at least 50% can decrease the immune system, which means creates bad bacteria in there, bad gut bacteria in there, and then changes everything around. So as simple as that, right? Neurotransmitters.
Yeah, and also like if you're under a lot of stress and that cortisol level remains too high, that will gut and by affecting your gut again affect your immune system and knock down your immune system. So like a lot of people get Hashimoto's disease, which is a immune disease of the thyroid gland.
Right.
And sometimes I'm not all the time, but a lot of times just by us getting the balance back and cortisol level down, we can actually get rid of that disease. So
yeah, absolutely. First things, just because you have an autoimmune, I had an autoimmune. It was diagnosed 20 years ago with it. It's been in remission. It doesn't show up. It's done, and that was by getting to the root cause, addressing GI, making sure adrenals were, all of it, right? So that whole root cause thing fixed it. So it's
I thought
awesome.
it was
just yeah. Okay, so we know that there's influencers on the microbiome, which is your bacteria, your ecosystem, if you will, and we are mostly bacteria. In fact, we're kind of a host for bacteria, which sounds creepy, but there's good guys and bad guys in there that are doing their job to have us function, right? But there are influences that can affect that.
The good bacteria are essential for our being, for our immune system.
Yes.
And we have a symbiotic relationship. It benefits them, it benefits us.
Yes. Make them happy.
Yeah, exactly.
Make the good guys happy. But things that will influence it, definitely pesticides in foods. It kills the bugs in the food. It kills the bugs in the gut, right? So I'm pretty adamant about a organic diet. Makes a huge difference. There's things we can control, right? Some environmental things we can't, but we can control a lot of this stuff on this list here, right?
So one of the things that's important with organic foods is, if it's non-organic, the chances are it's been treated with pesticides.
Right.
And pesticides are one of the biggest influences on our microbiome and our immune system. So
right. Yeah.
Try to buy organics. Not always easy. Like for instance, I eat blueberries every day. Blueberries is just like one of the healthiest foods there are. And I always try to get organic, but sometimes I can't get organic, so I make sure I wash it real well if they're not organic, but still it's much better to buy.
Yeah, there's a nonprofit called EWG.org, and it's awesome. They really go out there and battle for us to get things clean. There's a list called the Dirty Dozen Clean 15, and it shows you if you're going to buy organic, these are the must. Berries are one of them. And then the ones that you can kind of get away with, they don't really spray that much. They don't have to. Your local farmers market, you can, there's people that sell organic. They just don't have a certification because it's very expensive. But they don't spray, and so you get to know those farmers. You grow your own stuff. I've got some squash in my yard. I'm not kidding you. It came out this big. It's amazing.
I think something like bananas probably aren't as important to be organic as some other foods.
I don't know what list they're on, but from what I understand, they're gassed, and so right. So again, that's a good list to look up.
Yeah.
EWG.org. We put that on the website.
Yeah, that'd be good.
Yeah. Okay, so when injuries occur, these things happen, right? Then it gets crazy in there.
Dysbiosis means an imbalance,
Yes,
basically.
absolutely.
An overgrowth of one bacteria over the other.
Yeah.
They could all be normal bacteria, but you have too much of one,
Right.
as opposed to how much you should have.
Sure. And then what happens is you start reacting to foods like you never did before. They can be healthy foods too. Doesn't necessarily mean you're just reacting to gluten or dairy or the top 8 allergen, right? So when we start seeing, or you start reacting and having a lot of environmental sneezing and getting colds all the time and things like that, you got to think, okay, I got to really look at my immune system, my gut. So pathogens get infection like that. So yeah, this is
So this is a gut lining. You can see the villi at the very
top.
top here, and what leaky gut basically does is it kind of breaks down. Remember, the secretory IgA, which protects it.
Yeah.
That breaks down and it allows toxins to break through your intestinal barrier and
Yeah.
get into your system.
Right.
And so you have commensal bacteria that live in the gut, and then you have infective bacteria that can get into your bloodstream, that can cause systemic infection, make you really ill.
Yeah. So the top is looks like little hairs. They kind of think of a shag carpet, right? They're villi. What they do is pull the nutrients in. Somebody with celiac, those get blunt. So they get no nutrients in the body. That's why celiac is critical to address. And then the tight junctions are what holds everything together. So that's what opens up tight junctions. Something to say with Hashimoto's is, and the gluten-free diet, it's a real thing because gluten will trigger the zonulin to open the tight junction. Toxins get in, they go right for them. I put people on a gluten-free diet because the body's attacking itself because it's confused. That's autoimmune. It's just a lot of chaos that happens with leaky gut. Some of the symptoms with leaky, just you're not feeling well, brain fog, fatigue, rashes, people with eczema, people have any skin condition. I always go look at gut health.
And so you get arthritis, joint excessive. I mean,
headaches.
And then we were talking about before. People just say, "Oh, just feel brain fog." Well, it's one of the symptoms of leaky gut. That's why we do the test.
Yeah.
I mean, we can't. You give us everybody has the same 5 symptoms. The only way we could differentiate what's going on is by getting the 3 tests
individually. Yeah, what your body's doing right now. Tips, lifestyle is critical. Sleeping is so critical. Our body heals is when we sleep, and the systems that heal certain times of the night. So you want to have a good 8 hours, for the most part. You want to avoid obviously the metabolic diseases. We all do, but country is just, it's unfortunate. There's a lot of people that have that. And we can reverse that too, by the way. So again, foods, I always say avoid gluten. It is inflammatory. It's hybridized. It was basically created from a lab, if you will. It's not a real original plant that was put here from nature. Different DNA than what each parent plant had. It's a very long story, which is why I wrote my book on gluten, is because there's not only that, when it's harvested, it's heavily sprayed with Roundup, which is glyphosate, which is a neurotoxin, which kills the gut bacteria.
It's also carcinogenic.
Yes, it's no, gluten's not good. Again, we've talked about this before. Fermented foods are fabulous for gut health.
Yeah, I eat kimchi every day. And sauerkraut is also a good one. And I love kimchi anyway. But
kefirs, water kefir, you could do things like that. That's different.
kitchen,
Yes.
and if I drink, again, I drink some of the processed filtered water. This is great, has electrolytes and
Sugar, nothing added. Yeah.
right, no
Yeah.
sugar, 0 calories.
Right. And then really monitoring your medication. Like, why are you taking what you're taking? How long you've been taking it? Doctor, we require a physician. You have to have a regular doctor for our program. But again, Dr. Kremer could do that as well. But it's really important that the medications are, understood and brought in and figure out what's what with what you're taking, and supplements too. So that's important too. That's a whole nother area, but we definitely delve into stress management, lifestyle, exercise, movement, right? Environmental toxins around you, including people, right? But there's a lot that even in our house that can be toxic. Just really getting down to the root.
Yeah, one of the other things,
Yeah.
this one, of course, we talk about the GI profile. But
Yes.
one of the other tests we do is called organic acids.
Yeah.
And that's
Yes.
that's a urine. And literally we tell exactly how your metabolism is working. Where there's imbalances, where there's deficiencies of
Right.
certain could be vitamins, and we can
Like a
identify
metabolism.
that
Yeah.
and treat it.
Yeah. It's kind of looking at the way your body's processing, metabolizing, converting the food to energy, gut health. That's kind of a crossover where we see markers from that as well. But yeah, that's definitely another talk for sure. But that's a good one to even just go through a sample result on those labs, because it's so comprehensive and markers that you'd be blown. It's pretty awesome.
Yeah.
Yeah. What the body is just really made of too. So yeah, the GI profile is our gut test, GI map, right? So we're looking again at digestion, are you absorbing your nutrients? Do you have inflammation? How's your immune system, your gut, right? Your balance, things like that. So these are all indicators of where you're at with your health.
And
so
this is a nice little table. If you notice, like the numbers, the green's good, the yellow is like somewhere in the middle, and the red is bad.
Kind of like a stoplight.
Yeah, exactly. And this is a nice little tool for us, because it tells us what you have increase of, like this one, for example.
The inflammation marker.
The inflammation marker is calprotectin is increased. So that means they're.
Yes.
And here's some of the things we can give you that'll help that. A lot of these I take all the time. Omega-3s, turmeric, quercetin, zinc. I mean, so
right.
All this can help. And this is the dysbiosis, shows us what your balance is.
Sure.
And we can treat that.
Yeah, and amino acids to help rebuild the lining, rebuild the integrity in the gut as well is really critical. The dysbiosis marker, that one's high as well. Again, imbalance, infection. So the thing with healing the gut, you have to heal the infection first, right? Until you get rid of that, it's still going to just, be chaotic in there. So we got to remove. We got to kind of repair. We want to replace the nutrients you need, balance with the right supplements, things like that, diet, of course. And then you want to re-inoculate. You want to rebuild the microbiome, the balance, and make sure that you have that in check again.
And again, this also ties right back to our adrenal gland.
Yes.
Because
exactly.
If the cortisol level's too high, you're going to you could have like a little parasite in you.
Yes.
That you picked up somewhere. And if everything else is in balance, you wouldn't even know you had it.
Right.
But if your cortisol gets out of balance and your gut starts getting, and this little parasite says, "Wow, we got room to grow here," and all of a sudden you have a problem. So,
right, because they have a healthy environment.
Right. Exactly.
That they can grow in because they got what they need.
So that's why we have to hit this from all angles.
Right. So you look at the top, you can see all the different, digestive markers, infection, the metabolite imbalance, right? Inflammation, dysbiosis. It's really and it really does break it down. You go do a stool test, all your, a normal one or one you can get in the mail, so to speak. All it's looking for is blood in the stool, right? It's not looking for anything deeper than that. And so you want to dive deep into the gut, because that again is your core, and what's going on there. And then systemically, it's pretty amazing how things systemically, and the nice thing about the gut, cellular turnover is very good.
Yeah.
Like 72 hours, it's just amazing. So you have great opportunities to bring good in, get bad out, and just keep getting through that, right? It's pretty awesome. It's a great lab. So what we offer is a free consultation, because we want to, kind of discuss what's going on with you, see how it's a fit, see how our program works for you. We have a 6 and 12 month plan, all inclusive with everything, labs, consultations, and then just really give it some time to heal. It doesn't happen overnight.
Yeah, just remember
Yeah.
a lot of these imbalances that people have literally taken years
Yes.
for it to get to this
Yeah.
point. So it's not going to be taken care of in a week. So
Right.
it's a time, patience, changing lifestyles, and changing habits, and so forth.
Right. Well, the cool thing about that too is we're getting to the root, fixing the problem, so that you don't have to keep going back and trying to fix it, trying to address it, superficially, if you will. By just looking at symptoms and trying to work on those, you got to figure out why they're happening to begin with. So we're here for you. Just get in touch, check our website out, dmfunctionalmedicine.com, and we're here for you. So look forward to seeing you on the next one.
All right.
Think we'll talk about
more to come.
Yeah, we'll figure out a lot. We have a lot to talk about. So we just have to break it down.
Seriously.
So thanks for joining us, and we will see you soon.